Good morning, everybody. I'm Stefano Messori. I work for the World Organization for Animal Health, which is based in Paris. There I'm working on research coordination and collaboration at global level on animal health in an attempt to coordinate the efforts on animal health and provide good tools for controlling diseases in a fast way to improve preparedness. So what is the OIE? We are a pretty old organization. In 1920, we had a case of rinderpest in Belgium due to a transfer of zebus from Asia, India to Brazil. It created a big problem because the rinderpest was posing serious threat to cattle population worldwide. So it brought several nations, 28 at the time, to sign an agreement in 1924 establishing the Office International des Epizooties, which is based in Paris since then. So only more than 20 years afterwards, the United Nations were created. And in 2003, since the organization improved in size pretty much from the 28 countries that composed at the beginning, we changed the name in a more global way, and we are now called the World Organization for Animal Health. We still kept the acronym for historical reasons. So we changed very much from the beginning. We are now a bigger organization. We have 181 member countries from all over the globe. We draw expertise from a big network of expertise from 323 reference centers. They are either laboratories or collaborating centers that are based in our member countries. We have agreements with 71 international organizations. We still have our headquarters in Paris, and we have 12 regional offices that are spread all over the globe in the different regions. We work under the authority of the Assembly of Delegates. Delegates are normally chief veterinary officers. They are appointed by their governments, and they represent their own country. Under this authority, our Director General operates. Since last year, we do have a new Director General, it's Dr. Monique Eloi, that has brought her new inputs to the organization, and our focus now is protecting animals for preserving our future. This is just a small overview of where our regional and sub-regional representations are. So we have 5 regions. We have region of Africa, we have Bamako, that's our regional representation. Then we have 3 sub-regional offices in other parts of Africa. We have a regional representation in Tokyo for Asia and the Pacific, another one in Buenos Aires for the Americas, one in Moscow for Europe, and one in Beirut for the Middle East. One Health is very important for the OIE. It's been one of our bases for work and for developing our strategies for the future. So we do believe that human, animals, and ecosystem are very strictly interrelated, and we need to understand which these correlations are to better target our interventions in the future. So we do know that animals are important for providing proteins for human use, but still there are risks of emergencies and outbreaks of animal diseases, some of which are zoonoses. And we do know and recognize there are some problems of sustainability of animal production. So we need to work together to find common solutions that can address the problem for all these different perspectives. Talking from an animal and One Health point of view, just consider that about 60% of human diseases are of zoonotic origins, and among the emerging ones, about 75% are. So the interlink between human and animal health is very much there, and it's important to take into account. As Christopher told before, we do collaborate with other international organizations. We have been working with the World Health Organization and with the FAO for a long time now. We have formally agreed and built the tripartite, that is FAO, OIE, and WHO in 2010. And at the last annual coordination meeting in June 2017, we agreed on new strategic priorities, which will be, as you can see there, AMR, so antimicrobial resistance, health service strengthening both from the human and veterinary side, early warning surveillance system, foresight, preparedness and response, food safety challenges, coordinated research and development. We do have selected some priority pathogens, you can read there, but what's very important for today's symposium is that, as you can see, most of these strategic priorities have a strong, or can have a strong link with climate change. Of course, preparedness is fundamental to be ready to adapt to climate change. The OIE itself is not involved in fighting climate change. We are involved in fighting the consequences that climate change has on animal health and on veterinary public health. So our aim is not to convince country to pollute less, but is to find solution for the country to adapt to a situation that is changing, to get ready for the future challenges. So that was what the tripartite, let's say, program was, which were the priorities of the tripartite. This is what our strategic plan is for the OIE. We have been working toward our mandate, that is to improve animal health, animal welfare and veterinary public health worldwide. We work through strategic planning since 1990. We have a new strategic plan since last year, and these are the three main topics we will be focusing on. Controlling animal health risks, ensuring transparency in communication to improve trust among the different countries in trade, because we do provide standards for safe trade in animal and animal products, so trust is important among different countries, and transparency is the only way we can get trust. And reinforcing the resilience of animal health systems. These three main objectives are based on three enablers, which are scientific excellence, diversity engagement, and transparency and governance. We can't get any reliable standards for ensuring safe trade of animals without spreading of disease, without basing our standards on the latest knowledge of science. So we do need strong science supporting our work. We do need governance. We do need efficient services to implement standards and to implement surveillance in the different countries. And we do need transparency and engagement, as I told you before, to build trust. This is, I won't read all of it, this is our strategic plan. As you can see, climate change is in there. Let's see. So science-based standards are important, and these apply also to climate change. So as you can see, this is how we see the role of climate change in the framework of what our mandate and our daily work is. As I was mentioning, we are not fighting climate change. We are trying to mitigate its consequences on animal health. This is a report on the, this was mentioned before, on the intergovernmental platform on climate change, a panel, sorry, on climate change. And as you can see, these are the projections of which will be the impact on 8 main health areas of climate change. So the red spots are the impacts that cannot be changed, while the, I would say orange, but I'm colorblind, so it might be yellow or green, whatever, the other color, are the ones that can be actually changed through adaptation. So the area where we need to work on is this, let's say orange area. So we need to try to reduce, to act in a way of adapting to the change, to reduce as much as possible the consequences of climate change that's happening. As you can see, there are several issues that are related to what we are interested in, like food security, adverse weather events that have an impact on diseases, food and water-borne infection, and vector-borne diseases. As I was saying, we need to reinforce the resilience of animal health system. How we do that? In several ways. One of these ways is trying to improve and strengthen veterinary services. As Christopher mentioned before, we have the PVS program. That's the program we are implementing to implement, to improve the veterinary services worldwide. It's a program that's been running for more than 10 years now. Is a pathway. So we guide countries, we organize visit in the countries that require, that ask us to do that. We evaluate the veterinary services at central level, at regional and at local level, and we do identify which are the challenges for them, which are let's say we diagnose which are the disease that are present, the lacks, the gaps that are present in their systems. Once we do that, we try to prescribe some corrective actions that would help them in improving their system. And based on that, we propose some solutions that can be based on capacity building, on veterinary laboratories, on legislation, and so on. We give countries some time, and then we organize second visits to the country to see how they implemented the proposed solutions. And we do believe that an efficient veterinary service is fundamental to face new challenges and to be prepared to new challenges. The main topic of today, I decided to focus just to provide you some insight of what the issue would be on the animal health side related to climate change. I will just provide you some case studies. Most of them will be on vector-borne diseases. That's why vector-borne diseases are known to be very much influenced by climate change, and also because they are of increasing importance from both the human and the animal health side. They are a global issue, so there are issues that are common to many regions of the world. There are several factors that may affect the distribution and impact of these diseases, as was mentioned before by a colleague from the INRA. So environmental factors are one of the components that can alter vector-borne disease distribution. And there are other factors that are indirectly linked, again, to climate change, like social factors, the movement of population, that can be due to climate change, and that can have an impact on this disease as well. We, as OIE, we publish twice per year a scientific technical review, and we had some issues that were specifically focusing on climate change and impact on animal health. So you can find all of this material on our website, free for downloading in PDF if you're interested. And we had one that was about the vector range and influence of climate change on the disease, for which mosquitoes and culicoides were the main vectors. The first case study I will discuss about is Rift Valley fever. You probably, I don't know what the background of the people in the room is, so I will just provide some very general information. Is a virus, is a flavivirus of the Brunei family. Its distribution is in sub-Saharan Africa and Arabic Peninsula. You can see in blue the area where the disease is endemic, and in green the countries where the disease outbreaks are sometimes happening. The vector is an Aedes mosquitoes, and the species that are affected are ruminants, cattle, sheep, buffalo, and camels. Humans are also very susceptible to disease that could be fatal in humans. What's the impact of the disease in animals? So in ruminants, it causes abortion, neonatal mortality, and liver damage. Case fatality for humans is less than 1%. It can be transmitted to humans through mosquitoes or through contact with infected blood. For example, slaughterhouse workers are one of the category of people that are most at risk for contracting this zoonosis. The distribution of Rift Valley fever related to climatic conditions that are favoring the breeding of the mosquito vectors. These mosquitoes are food-water breeders, so they depose their eggs in ponds that are flooded. Then these eggs, when the water evaporates, can stay there for even a long time, and when a new flood happens, we have a massive hatching of these eggs, and we have periodic outbreaks of the disease. So the episodic outbreaks in Africa among the peri-epidemic countries are associated with particular weather condition and we are observing a shortening of the inter-epidemic period due to the increase of climatic condition. Outbreaks of Rift Valley fever are very much linked to El Nino phenomenon, and since it is changing, Rift Valley fever outbreaks are changing accordingly. This is just to show you a short presentation that was given by the Crisis Management Center concerning the Niger outbreaks of Rift Valley fever last year. So as you can see, as soon as the high rain season arrived, so in unexpectedly high rain happened, cases appeared in animals and following that in humans. And since they have a big nomadic event in the country, so animals will move, and so the disease spread to neighboring country. So it is an issue, and climate change plays a role on the distribution of disease. Another case that is more near to this region of the world is Lumpy Skin Disease. It's another viral disease, vector-borne again. Vector are all biting insects, flies, mosquitoes, and ticks. It's a capripox virus. It is distributed in Africa and Middle East, and now in Eastern Europe and Eurasia. It affects cattle and buffalo, and it's economically important because it decreases milk production, it decreases the price of the hides of the animals because it causes these lumps on the skin, and it causes sterility in the males, and it might cause death due to secondary infections. The disease was only in Africa and Middle East. It has been only in Africa for a long time, and then it moved to the Middle East and just arrived to Europe very recently, where it is spreading pretty fast. So that's just a quick overview of what the last report was done at the EU Animal Health Advisory Committee concerning the disease spread and the vaccination campaigns that are going on to try to stop the disease. This is a study that was performed by some colleague of mine that work in WAHIS team. So we are managing since 2005 a system that registers all the outbreaks of animal diseases, of the notifiable diseases. This is a big list of diseases that are of relevance either for humans or for animal populations that are important at global level. Most of the relevant, well, all of the relevant diseases are there, and one of the commitment of the member countries of the OIE is to communicate to the OIE as soon as possible of the outbreaks of this disease in their country. We are collecting all the information through the WAHIS. This allows us to do some kind of analysis. So to assess where, as in this case, where these outbreaks happen. What we observe, for what concerns LSD, is that while in 2006, this was the average was at this latitude, it increased very much by 2016. Imagining it from a more metric perspective, we can say that the outbreaks average move of 3,000 kilometers north in 10 years. That is a big movement, and climate change is one of the drivers of the change. Another case study, again, of interest to this region is Bluetongue. Is another vector-borne disease, is another virus, is seasonal in many parts of the world, is transmitted by culicoides, is mostly inapparent in cattle, with the exception of some serotypes. It can cause a more serious disease in sheep with a significant mortality. Severe cases causes acute febrile responses and hyperemia and congestion of several tissues, including the tongue that gets blue. That's why it's called Bluetongue. It has severe consequences on the livestock production because of loss in production, expenses for vaccination, and trade barriers that are set up as soon as the disease manifests. Between 2005 and 2007, the number of OIE member countries reporting outbreak increased from 15 to 27%. So again, we had about 15%, well, a 100% increase of the number of countries that communicated outbreaks of this disease in all the time span of 2 years. And again, the distribution of the vector that is also linked to climate change is one of the causes of this movement. Moving on from vector-borne diseases, there are other diseases that can be influenced by climate change. That's the case of influenza. It's not a direct impact, it's not a vector disease, so it's not a direct impact on the disease itself, but climate change is changing migratory patterns of birds. So the change of migratory patterns made that the virus that normally has a distribution is assuming different distributions, since the birds that are affected are moving in different regions of the world. So it is still debated. We still don't know which will be the impact of climate change on influenza. There is studies going on, and this is an example of another publication we have in one of our technical reviews. So it's not only vector-borne disease, it's also other viral disease as well as bacterial disease, but again in a different way. Anthrax is a bacterial disease. Bacillus anthracis is a causative agent, is cosmopolite everywhere in the world, is primary disease of herbivores, but affects all mammals and some birds, including, of course, man. Mortality can be very high, and spores are very long-lasting. They can live tens of years in the soil. And animals get infected by ingestion of spores. You might have heard of it because it was in the news last year. So there has been an increase in temperature in Russia that has been more marked in the northern part of Russia. This caused the permafrost to thaw and to expose some burial places for animals. Some of the burial places were very deep because it's not easy to dig in the permafrost. So in case of past outbreaks of anthrax, animals have been just put down permafrost there. And now that permafrost has thawed, these animals have exposed and causes serious outbreaks of anthrax in the regions that brought to the killing of 2,500 reindeers and to the death of one person. So this is also another angle on which we should think about when assessing climate change impact on animal health. A very last case study, that's Vespa velutina. It's not a disease itself. It's an invasive species in our region. It is an insect that invades honeybee hives, removing the brood and taking honey reserves. So it basically kills the hive. This species was originally in Asia, and now it invaded South Korea, Europe, and Japan very recently. And due to climatic condition changes, there are projections that says that by 2100, by 22,100, yeah, I don't know how to say it. Anyway, the invasion risk would increase, as you can see, in most of the world. Again, honeybees are a very important pollinator, and without honeybees as pollinator, well, agriculture will die probably. So it is another aspect to be taken into account. So, which are the main challenges? Just to debrief, climate change creates risk for human and animals, as well as on food security. There is a complex and dynamic international epidemiological situation that requires ongoing research and surveillance. The OIE is involved now on this consortium of research that's targeting priority diseases to get to results faster. And one of our priority disease group is vector-borne diseases. That, as I showed you, is very much linked to climate change. We do have some predictive capacity, but the complexity, uncertainty, and variability affect our understanding of specific risks and scenarios. It is very important to strengthen health services, I would think from the vet side, but I suppose it's the same for the medical side, to be ready to start mitigation and management procedures for the new situation. We need to have an ongoing commitment to develop support, multilateralism, regulatory conversion and harmonization with international standards. And we need to merge the scientific need with the political and economic needs, also including cultural consideration to be sure of having effective solutions. What is the OIE doing in particular? So we are working on advocacy of veterinary services, adaptation to climate change, biodiversity and One Health. Through our Assembly of Delegates, we try to push the veterinary services to be ready for the changes that are coming. We provide support to our members through science, surveillance, intelligence and training. So we are doing a lot of capacity building that also touch on climate change impact. It's important to work in partnership with other international bodies, with scientists, with private and public sector. And we need to build capacities for veterinary services. These are just a few examples of what we are currently doing. So we did organize an event 2 years ago in Paris, together with the World Farm Organization, just to investigate what would be the agriculture in the post-Kyoto terrain. You can see there some of our publication or conferences we organized that touch on climate change impact. And I'm done. Thank you.